The moment that I realized I wanted to pursue medicine was actually very early in my childhood. I always had an interest for just solving problems, but they always happened to be like medical problems. My grandfather, where I was born in a different country, he was a physician. He was a primary care physician. So I used to steal his books from his library, and I would look at the pictures because I was so intrigued. I got in trouble many times for that, but it was worth it. It was that first introduction to being interested. I ended up going into cardiology straight out of PA school because it was a bigger challenge than everything else that I was interested in. The part that drove me into the senior primary care was actually the cardiology part of it, because most of my patients in cardiology were seniors. And I realized that I could relate to them better in a sense that I understood them. You know, I have grandparents. I think technically I'm an old soul that had the opportunity to, you know, be here and help them and understand them. I feel like it's important for a provider and a patient to have a good, solid relationship, because that's what I would want if I was being cared for. I want somebody that I have, in a sense, an open door policy, that I can say anything to, that I'm not embarrassed, that I know I'm not going to be judged. So having a good, solid foundation, that baseline where people feel like you are, you know, part of their family or a friend, is very important, because that makes them, first of all, a little more compliant with their care. But second of all, it makes them really open up and tell us what's wrong. I would like to provide each of my patients a very simple message. You know, we are here to take care of you. I want you to feel like you're part of your family, that when you need something, that you are always going to be our priority. My name is Blanca Bohman. I am a physician assistant that specializes in senior primary care at Intermountain Health.